I'm going live.
Okay.
Good evening, viewers. Richa here from Family Affairs. I'm here along with Sabha and Gagan. We have two wonderful guests here. They are mother-daughter duo, power-packed couple. I must say, I met them a few years back, and I can't be more thankful. So here, I'm welcoming Dr. Renu Nath and Dr. Ashima Nath. They are homeopathic doctors, and they are doing such great work in the field of serving humankind and also animals. They have a separate passion for treating animals, and that's how I connected with them. So welcome, doctors.
Thank you.
Yeah,
We would like to have a little introduction about both of you.
yeah. So, like being senior, I'll start first. so, I, I'm a homeopath practicing for 44 years now. I studied at Anand Homeopathic Medical College, and I'm a gold medalist. And homeopathy came to me from my father. He was a hobby practitioner, and he always wanted one of his children to be a homeopath. And I have my own individual clinic, and I'm also doing online consultation for last 20 years. And veterinary homeopathy started around 17 years back when we had pets. So I came to
Wow.
know that we can give it to them also. And now we have recently learned about agri homeopathy also. So I'm giving homeopathy to my plants also. So
Wow.
yes, and I'm getting very good results. And like then comes my daughter Ashima.
Okay.
Welcome. Thank you so much.
So I think pretty much most of what she said about it being in the blood applied to me 2 generations over. But I was keen to explore the world outside too. So I studied management after also being a gold medalist in homeopathy. But
Same college. We were
same
in same
college, and
college.
after 25 years, repeated that. But then also went on to study management from one of the top 10 management schools in the country. Joined IBM India also and worked with them for about 12 years before finally deciding to sort of come back full circle and do more digital transformation for Homeocare than I did for IBM in all those 12 years. So I worked a lot to take this all pretty much online and across the world. She was doing it in some way, but we have now platformized it and taken it to
Yeah.
Instagram and social media and all of that. And we work with a range of animals, not just dogs and cats as most people would think. We've also treated birds and donkeys and horses and cows
Cows and everything.
for a plethora of diseases. So yeah, here we are and open to your questions.
Wow, that is commendable. So amazing. 3 generations practicing. So my Dadaji was also, homeopath. After he retired, he started practicing and he was really good. And I also know half the stuff. So, I'm also half doctor without studying. So very lot of our family. So, my number six, my next homemaker, my, Annika, everything is handy. So, all of us, I think, have taken from him. So thank you so much for taking out time. I know you both are so busy. So I would want to ask, like homeopathy, everybody knows, but what is the actual science behind it? A little bit more about the practice.
Okay.
Okay, I'll take that. See, it is a science, but it is a science that is difficult to explain to lay people. But having said that, in simple words, it talks about similia similibus curanter, which means like cures like. For example, the commonest example we use is that if you're chopping onions and you will have symptoms of sneezing and eyes watering and so on. So, whenever you have those symptoms, for example, in a cold or an allergy, if I use medicine made from onion, which is Allium cepa, that is helpful to you to cure your symptoms. So, we have over 3,500 medicines coming from all sorts of sources, including plants, animals, minerals, and others. To
No
use
chemicals in it.
So you use potentized or powerized forms of these medicines to treat and to work with your own body's sense of healing to bring about a cure. So it is useful for chronic, and what people don't think is useful for, but we use it extensively for, is also in acute diseases and emergency care as well.
I've seen that because Zara had cancer, and when we connected with you for her lymphoma, you know, we, we prolonged her, illness for about 7, 8 months, and she was at ease. So yes. So another very basic question that everybody asks, how is it different from other alternative forms of practices?
So, in some ways, it is different, and in some ways, it's not. It is similar primarily in the way that we look at things more holistically. Like, even if you look at Ayurveda, it is a very holistic sense of system of medicine, right? And so are we. We will not give you one medicine for fever, one for a cold, another for a body pain, third for a liver, fourth for a kidney. We would combine everything and sort of give you one or maximum, usually now, maybe sometimes to bring you immediate relief, two medicines. But typically, Ayurveda would do something similar, and ditto with a lot of other alternative forms of medicines. So in that we are similar to them, differently because we of course have a different pathy to treat this, right? Like we say it's like cures, like we do not work against the body, we work with the body. So in
we
that
we help increase our body immunity, like develop the immunity to cure that disease. So it's a cure, not only treatment. That is the difference. We treat a person, not only one disease. Or if you come to us for, say, repeated bronchitis, but I would still ask head to toe, you have acidity, you have like any other ailment of like skin issues, or then to make individualize a case, we ask about how's your thirst, how is your appetite, and how is your sweating, and do you sleep well, and do you get dreams. And people say, oh, why so many questions? So these questions help us to individualize a patient, and it's an
Wow.
individual tailor-made medicine what we prescribe. So if four people have repeated bronchitis, their medicines will be different, because the rest of the things, the life
Wow. So that
situation
was
which
the
has,
question.
yeah,
So
can
that was a question I wanted to ask, when you've answered it yourself, why do doctors ask so much questions? This is about individualized prescriptions and individualized treatment for that particular person.
yeah,
Great.
right, right.
A little bit more about veterinary homeopathy and then about agri homeopathy, which you just talked about. Very enlightening term I learned today.
Yeah.
So the veterinary bit, we sort of stumbled upon with our own pets, like she said. She with hers, and then I with mine. I had an accident case that I rescued and now have adopted. So we've worked and we found that animals actually suffer from pretty much everything that humans do, including the mental health issues and physical ones as well. So and they're often, more often than not, they're treated with very strong medication, and every time there is a skin flare up, etc., they are given um, you know medication to, like, steroids or antibiotics, repeated cycles of this. Most of them have very strong side effects. So could we use homeopathy? It's so harmless. That's how it started, and now we are working with a range of animals. Initially, of course, we started with dogs, but we now work with cats and donkeys, birds, horses, cows. I
Oh,
so
Yes.
so of course the dosages vary. We struggled a bit. For example, we had no clue how to figure out a dosage for a cow. It's a 400 kg animal, so we just gave them a
Richa,
handful
people are
of
not
pills.
able to log in. I'm getting repeated messages that we are trying but not able to
Will
log
they be able to log in now to the group? Are we streaming this on the group as well?
this is live, so you have to go to the Facebook
in.
page,
That's what they
Family
are
Affair.
saying.
It will be
It
there.
said live, but we are not able to join.
1 second. So they have to go to Facebook and the Family Affair page, and it will be broadcasted over there.
Can you
Family
share
Affair.
the link so that I
आप
can?
लिंक भेज दीजिएगा so we can share it.
Yeah, in the meantime, I'll do that. I'll so you guys can answer the question. I'll do that
Yeah,
on
yeah.
the side.
Sorry.
Yeah.
Sorry. So yeah, so that's how it went on to other animals, and that's the veterinary bit. Agri is something we actually learned from one of our students, one of our junior doctors who was researching on this, and she came to us and told us, Dr. Riddhi Shah Patel,
Patel.
Dr. Riddhi Patel, and she's done her research on this, and we are now working, and we've tried it at home as well. Um, for emaciated plants, weak plants, we are trying dilutions and watering it with that, and we've seen good results. So we're hoping to publish her research and add some of our own proof points and bring that forth for others to work with.
Regarding veterinary homeopathy, I would like to add a point that like people are surprised, amazed when I say that emotional stress causes the disease, even in animals. So when I take back them on the like life history path, we find the cause of the disease, time of the disease, and time of the emotional stress. Like people keep their pets in boarding, so that separation anxiety, or maybe some abuse, or maybe grooming places, or the like whatever stress they go through, and then their immunity goes down and they come out with symptoms. So when we go back to the history and track that and treat accordingly, then it is proved that yeah, animals also have emotional stress and they go through disease because of that, as humans go. Like you must have heard people saying जो खुश रहते हैं वो जल्दी बीमार नहीं होते, and
Yeah.
like so that there is a scientific reason behind it. Now we know what all hormones are released when we are stressed, and we know when we are happy what all hormones are released. So similar thing happens for them. So
So I just tried to, show the live stream. I've sent you the link, doctor. You can send it to your friends. So it's here on Family Affairs. I'll just show you also. I think a lot of times, we don't know how it's happening. I'll just show you. I've just shared the screen. And from the Facebook page, we go to Family Affairs, and here we are live. You can see us right here.
mm,
So
Yeah.
right now we are actually live. Yeah.
Okay.
yeah.
Cool. All right.
So I'll stop sharing
Yeah,
this.
that's on veterinary homeopathy. So, Richa, we are also publishing a lot of these results as testimonials and case studies on our Instagram handle. A lot of people who see the Instagram handle think we are only veterinary doctors, but actually, uh,
Even I thought
most
so initially.
yeah, actually, that's because human homeopathy is well known. It's not something new to the world, but veterinary homeopathy with before and after pictures and testimonials from the pet parents, etc., is relatively newer. So we're talking more about that to make people aware of what's going on.
Great. So, what about agri? A little bit, how are we
Yeah,
benefiting with
similar
plants?
thing. See, as I must, like, I should share this. I have a beautiful money plant in my drawing room. So, like, everybody comes and asks, कि, ये इतना अच्छा कैसे है? So I say, मैं प्यार से उसको रखती हूँ. So when they say plant को प्यार से रखते हो, I said, yes, plant को प्यार से रखती हूँ. Or I, while watering them, those that plant, I would say like you are very good and you are growing well, and so like that. And similar feelings we translate into homeopathy. If we find some disease, if we are out for a few days and they feel neglected, though maids are there to water them, but the shine of the plant goes. And once you are back, so, and those points I covered. One of my kadi patta plant was not growing, so I asked Dr. Riddhi that you have done this. So he said, ma'am, try this. I said, what points you are saying this? And she explained that retarded growth and all that, those things. And I'm like watering my plant with that, and every day saying that no, this is going to help you, and it started doing well.
Wow.
Yeah.
आप मुझे बताइएगा which one to put. So I will also ask now, like, full-fledged career, I'm sure any career path is not easy. It looks very lucrative and very nice. Oh, okay, they are practicing now that you establish yourself. But I'm sure there's so much of trials and tribulations. So, a little bit about your work-life balance and how
Yes. So I'll tell
your
you,
career journey.
like, when I like got married, and see, my day of my engagement and day of my result was the same day. The day I got engaged, that day evening, I got the result, and within 8 days I was married. My husband was abroad those days. My only condition was that I want to practice, and he's kind enough. He allowed me,
Wow.
and uh, and he helped me to set up my clinic in the first place. You don't have those kind of finances, so he helped me with those things, and I started my practice. And with God's grace, my father's blessings, I started doing well from the very first month. Then soon I was pregnant with my daughter, and then she came into our life. But I made my clinic at home. One room we allocated to the clinic, and then I remember, if I'm doing bandage to some patient or dressing to some patient, mama mat maro, mama usko mat rulao. like how children are. So then I opened my own clinic. I started with my own clinic, and then the stress starts. They'll pull out my sari, my dupatta, mama mat jao, and those things happen. But somehow I managed. My clinic was very near to my residence. So once I remember, my son calls me and says, "मम्मा मुझे फोन पे बता दो शूलेस कैसे बांधती हैं." I said, "बेटा फोन पे नहीं बता सकते ये." So then I went. I tied his lace and he went out slaying. So breathing problems of those things did come, but I was like bent upon
Passionate,
passion,
hardworking.
passion. Practically, if you see in the clinic, all sorts of patients come. हर तरह के, मतलब गलत बोलने वाले भी आए, गलत सुनाने वाले भी आए, एंड बीइंग अ लेडी प्रैक्टिशनर यू नो हाउ वी हैव टू फेस ऑल दैट. एंड शुरू शुरू में तो मैं अकेली थी, इतनी प्रैक्टिस नहीं थी, आई यूज्ड टू सिट अलोन. तो हर तरह के लोग आकर के उल्टी सीधी बातें भी करते थे, बट देन आई समहाउ लर्न एंड आई मैनेज्ड इट.
I
देन
still remember when I was younger, my Dadaji's, clinic had all these big bound books. So he used to always keep reading. And then,
यस,
when we used to come, so his compounder used to give us, just blank pills because,
एग्जैक्टली,
maybe we wanted that pudiya. We used to call it pudiya. So we wanted the pudiya and we wanted to eat it. But, doctor,
हाँ.
coming back, how challenging was it as a woman in a male dominated field? Because mostly,
It
they are men
was, it
practitioners.
it was challenging. That's what I said कि being a lady, हर तरह के लोग चीजें challenges हमने face किए हैं. But जैसे जैसे as you start working,
जी.
confidence comes. फिर पता चल जाता है कि ये बंदा क्या चाहता है, क्यों ऐसा बोला. डॉक्टर कैन आई गिव यू कार्ड, आई सेड यस. तो मुझे नहीं ध्यान था कि वैलेंटाइन डे आ गया, उसने मुझे नेक्स्ट वैलेंटाइन कार्ड ला के दे दिया. सो any like this is a small thing, but वैसे कह रही हूँ कि you learn. I have learned all those things. फिर धीरे धीरे I started keeping staff. Now I have staff of 7 people. So
Wow.
Thoda bahut journey we've also had in terms of learning how to do things online. And I think COVID was a big learning for all of us.
Ashima is
Although,
responsible. She taught me all that.
no, she was doing PayPal way back in 2002, Diksha. I mean, I think she must be one
Wow.
of the first few people using PayPal in India. Okay, I was in college
Wow.
then. But, so she wanted to learn. But the good thing is, like, see, as a business, we were online ready long ago. Okay. I mean, it used to be a small part of her practice. I was still working with IBM, so it was a very small part of my anyway of my practice because I used to only do it on the side. But as a charitable thing or for animals or for family and friends. But as COVID came along, it was sort of it changed a lot of things for a lot of people, isn't it? So hum to, like, the sentence I always use is कि हम तो कब से we were online and ready. But COVID made patients online and ready to accept that
Exactly.
this can be done online too. um, not having a doctor face to face is a new thing. Even it was a new thing before COVID for people. And my mom, at least, she has a clinic. She's available for consultations if should someone decide to come. Me, on the other hand, I have 100% online practice. So even if someone in my own building wants to consult me, they have to book something online and do a video call. There
Wow.
is no way they can meet me in person. So, but thankfully, COVID at least opened up people's minds to the idea of remote consultations. And also at that point, we were ready with a setup that allowed us to ship medicines to people's doorsteps. And we were one of the few industries and businesses that sort of did well in COVID, because we could still deliver through the lockdown, except for the first lockdown of 21 days. I remember the day the post office opened on day 22, we were speed posting shipments, and by the time we sort of ended the lockdown, we were doing couriers and speed posts and everything across to the remotest parts of the country. So that, I think, was a very big learning for all of us. This is a model that can work even in totally remote setup from the patient, and I think we didn't see a patient for 6 months plus
Yeah, nah,
during that
2 years.
time.
I didn't go to my clinic for 2 years.
You were
Everything on
busy
clinic maybe आएगा तो it'll be on webcam,
online.
and we see the skin pictures. My assistant would examine the throat and all. I was not going, man. Like अभी age हो गई मम्मा, आप clinic में risk नहीं लोगे.
No, I remember when I consulted, I sent you everything on WhatsApp, all the X-rays, all the reports. So I think that
Yes,
was
all
a
that.
big, as you said, you were ready. COVID made everyone ready to accept it. I think that's what happened. No, thank you so much. I
and
think the kind of
and we
work
found
which is
acceptance
coming in.
thankfully from many quarters, Richa. We've had one of the biggest validations we have sort of received as doctors and as businesses in this area is other vets being recommending us and collaborating with us to work on cases. Like, it's not just that हम सोचते हैं कि alternate medicine मतलब you will alienate your vet or you will alienate your normal physician and work with a homeopath.
No, no.
Fortunately, honestly, veterinarians have been very open to working with homeopaths. Like, I'm not sure how your experience was with your particular pet, like she was referring to, but many cases of lymphomas and malignancies and skin mein to we've had so many veterinary prescriptions with our website link and phone numbers.
Yeah, they write.
They write our
Consult
names
Dr.
and
Nath.
consult
Consult.
Dr. Nath or our website. So it is a learning for us and for patients also, that it is possible to have a collaborative ecosystem working for the well-being
Of
of a
course.
patient. So, because a lot of people say that, can I give homeopathy with allopathy and all that? So, of course, you
Yes,
can,
you can.
first of all.
Yeah.
And, it's not as if you need to hide this from your doctor or anything like that. It's absolutely possible to collaborate and do this.
So, what happened last year? I was having a very bad stomach flu. I don't know, some kind of bacterial infection happened. And for 2, 3 months, I was eating even home food and I was, having a trigger. I was having my doozies and I went to so many doctors and finally I gave up. So, one day my bua called and I told her, she said, Richa, magnesium फॉस खाओ 40x. I said,
Hmm.
ठीक है, मैंने मंगाया, started eating, you won't believe it. Within a week, I got okay. And I
Hmm.
like, my goodness, I have done everything. And, and because of my Dadaji, everybody knows a bit. So, I was just speaking with her. She said, get magnesium phos 40x and 200 and तुम खाओ इसको, तुम ठीक हो जाओगी. And I was fine. And I was like, and it's all about the faith also. It's all about having that faith that, what I'm eating is going to help me. So
Of
I'm a
course,
true
that
believer,
comes
obviously
first.
with family roots as well. So, doctor, coming back to a little bit fun part, what is your mantra? What keeps you both going in life with such a hectic schedule? I'm sure it takes a toll when you see a lot of
Passion
misery
for my
also.
passion and love for my science keeps me going. I want
Wow.
to work till the last day of my life. That's what I have declared. Don't ask me to retire. I'm not going
Slow
to
down.
retire. Yeah, and that is my, like I always say कि मेरी बैटरी चार्जिंग वहां जाके होती है, मुझे क्लिनिक जाने दो. I would be saying, oh दर्द इधर, दर्द उधर, but when I come back from clinic, my husband says कि गई थी तो रोती हुई, आई है हंसती हुई. That's it. That's the change my clinic gives me.
Wow.
So
And
I
what
get
about you?
love, I get respect, I get money, everything comes from there. So I am happy. And that's the biggest part. Of course, my children's success and like
Of course, yeah.
family support and all those things keep me going. And our family is in a big way of helping others. So we donate a lot. हमारी सबकी हॉबी है, हम बच्चों को पढ़ाते हैं, बहुत बच्चे पढ़ाते हैं. एंड व्हेन वी गेट द फीडबैक कि हाँ वो लड़का अब इंजीनियर बन गया, ही इज सेटल्ड अब्रॉड एंड इज अर्निंग सो मच, दैट इज द पुश वी गेट. या, so happy. And so many things like family support and all such things. Love for animals is the big thing we do. So that, Ashima,
That's
you
one
tell me.
of the things that keeps me going in a big way. Like personally, I really enjoy working with the animal side of this, and we work with a lot of shelters and
Mm.
fosterers and rescuers, street
Yes,
animals
yes.
across the country. So happy to say that we've not ever charged a consultation for any of them,
Wow.
ever. So whatever we are able to do in our capacity, limited hai because there are just two of us.
Of course,
Uh,
yeah.
but whatever we are able to do for animals across the country, we've tried to support. And certain things like skin issues and distemper, etc., for street animals is something that has very little structural or systemic support. So that we are trying to do whatever we can help them.
Wow. So do you have
That
any
that
hobbies?
gives me a big push personally to work with someone like that.
I'm sure. So do you have any hobbies? What do you do in your free time?
That's yours. I personally don't have too many hobbies except playing with my dog, but she has a lot more.
I love cooking. Cooking is my passion. And
Wow.
so many things. I love knitting. I love crochet. I love many things. Like, even I cannot sit idle. So I have to do something or the other. I keep doing. And of course,
Multi-talented.
well, I love cooking, and cooking is my hobby. एंड ऑफ कोर्स जो भी काम करो, अगर सामने से प्रेज मिलता है तो यू गेट एनकरेज. So and pastime is Candy Crush.
Oh, really? Wow. Seriously, that's so cute.
रात को आधा घंटा आई मस्ट प्ले, देन ओनली आई
I
स्लीप.
I was addicted to Scrabble, so my joints started hurting. So I kind of then removed the app. I said I can't do this, but that's so nice. So any advice for women out there and also students who want to take up homeopathy as a career, and then obviously to women practitioners and women out there?
See, two things. One is, like, I had participated in a debate whether a lady doctor should marry, and if yes, to whom. So my reply is yes. Lady doctor should marry because she's a lady first and doctor later. And being a homeopath, it further helps. It's like not as such a odd time practice. You can decide your own time and practice. We don't have emergencies. And it is very very rather, if you see in homeopathic colleges, like more girls are there than the boys. It's another thing, maybe some people will not agree. Homeopathy requires a lot of emotional touch to it, and that ladies have better. I while taking dogs cases also, I say I would like to talk to lady of the house, because most men will say कुछ नहीं हुआ. When I ask to ladies, they say no, ऐसा nature है, ऐसा nature है. So that emotional part of it, ladies know better. So
They can.
same way for human beings also. So it's a better option for ladies, and of course it's the best science one can practice.
What about you, Ashima? Any guide, anything for the women out
In
there?
terms of careers, which I'll say, like, I'll compare this for a moment with conventional medicine also, okay? Because a lot of people first get into conventional medicine and then realize that, it's a 15-year journey before you get anywhere near a patient commercially. Um, so for us, that time frame is slightly lesser, first of all. Given that we don't need to specialize in gastroenterology or eyes or nails, no nose or anything, you can start practicing the minute you have a degree. Okay, so that's one of the things I think that doctors do think of. Having said that, I do realize that not many come into homeopathy by their first choice. And secondly, like, end of the day, one cannot get into this just looking at veterinary homeopathy. It has to be, we specialize as human doctors, right? Like, we come here first. Not everybody is able to practice the animal homeopathy side of this without having a platform of online reach and all of that. So my tips to girls or boys, regardless, starting out on this, is that it needs a lot of study, not just in the field of medicine, but also in psychology and understanding people and understanding animals for that matter. Like, it seems so easy for someone to say, "Kya, acha, they treat animals also must be easy."
Mm-hmm.
What इसमें क्या बड़ी बात है, but to understand how an animal behaves, like for example I had to study canine body language, behavior training, all of that, and some of it I share with her, some of it I don't, but the thing is, mental health and its emotional well-being is important for any human, regardless of being a plant or any sort of animal or human. So that also is something that Western medicine is discovering now, and
Yeah.
we anyway believed in for a long while. So if you're someone who believes that really just pushing a pill is not the answer, then this is the science that we have.
Wow. Any parting thoughts for us? It was such a delight speaking with both of you. Anything else you want to, tell us about?
Anything, see, anything in your life you want to do it with passion. If you love your profession, if you do it like with your heart and soul, you are going to be a successful person, in not in only in your professional life, in personal life also, I would say.
Wow.
Like, be
Really nice.
sincere and be truthful, and all those things are very important.
So, Doctor, we've got a question. Just quickly, we'll take two questions. One viewer has asked, can diabetic patients take homeopathic medicine because they're supposed to have sugar pills?
Yes, they can.
They can.
The total amount of sugar, and I weighed this on a digital weighing scale once. Typically, the day's sugar intake of medication is less than 1 gram of sugar. So it's harmless. Even people on ketogenic diets or very low carb diets can very safely take it, diabetics included. It really has no impact. Even if you're taking the sugar variant, that is.
And
Sometimes we may also give liquids and all of that, but
so
even the
that
sugar
should
one.
be okay. Another question is one viewer has asked that you were talking about mental health in animals and also in humans. So, if you can tell us a little bit more.
Yeah. So, as a holistic system, we believe that the mind, is a very integral part of the body. In fact, it's sort of on top of the body, physically and otherwise. So, when our emotions are upset, typically it translates into our body being unwell too. So, we must give the emotional well-being and the stress part of it a lot of importance. We do that when we take our case histories. We give it importance even in animals, like animals losing their babies, or having deaths in the family. For example, COVID quarantines is something that animals had no idea what was happening. Okay,
What
and
that
we had
meant.
to ask at that time. We had to ask at that time, like, because the animal was sitting outside the door, not knowing why he was not being let in. So these sort of events we have
Other way
found.
also, like parents were always home those days, and suddenly when after COVID they start going
Going
out to
back to
back
work.
to office, they all suffered from great separation anxiety. So mental health, then the symptoms come, and then we know how mental health has translated into physical symptoms. I always say mind always speaks in the form of symptoms that you're not happy.
I remember you had also asked me these questions when I had initially consulted you for Zara.
Yes, yes, yes.
Thank you so much, Dr. Renu and Dr.
Yes.
Ashima. It was such a delight to have you on our show. Viewers,
Thank
I
you.
have left their link on the face on our page, and also I leave their credentials. So do reach out to them. They are there to help you out. And thank you so much, both of you. Such a lovely, powerful duo. I wish you all the best, and also from Sabha and Gagan, our partners, and I wish both of you continued success. And Dr. Renu, आपके तो मुझे खाने के भी अब देखने हैं post. Please start posting pictures whenever you send your candy crush scores. I would love to see them as and when.
Yeah, sure.
Thank you, and thank you for having us. Thank you.
Thank you so much. Have a good evening. Bye bye.
Thank
Bye,
you.
bye.
Bye.